our chief guest, Her Excellency Dr. Caroline Karugu, Deputy Governor of the County Government of Nyeri, government officials, members of the Diplomatic Corps, Dr. Azim Lakhani, Resident Representative of the Aga Khan Development Network in Kenya, Mr. Yusuf Keshavji, Trustee of the Aga Khan University, members of the Postal Corporation of Kenya, our donors, partners, supporters, distinguished guests, ladies and gentlemen. I would like to welcome you today to this gala dinner to mark the 60th anniversary of the Aga Khan University Hospital in Nairobi. I'm not sure I need to stand up here and speak after the stories that we've heard. I think the most important thing that I hope you got from this short speeches from our patients and our doctors, that the one message you took away is that we are a patient-centric hospital. And that's not easy to achieve or easy to say, but I think it's very important that people understand the distinction or the distinguishing feature or principle of this particular hospital. So today, as we celebrate our impact and achievements over the last 60 years and look forward to the next 60 years of our contribution with innovation and leadership, our theme of this celebration is first from the beginning, as we have earned the position of leadership with many firsts in health services and education, of health professionals, and all recognized to be at an international standard. But I would like to begin by paying tribute to His Highness the Aga Khan and his grandfather, Sir Sultan Muhammad Shah Aga Khan, whose vision, inspiration, and financial support created the hospital and over the last 60 years has guided its expansion to new programs and new services. This hospital was created before independence to serve all Kenyans, regardless of their ethnicity, religion, nationality, or ability to pay. And today, we continue to follow the same ethos. In fact, many of you may not know that President Uhuru Kenyatta was born at this hospital. We mark this day with the launch of commemorative stamps and the unveiling of a coffee table book that illustrates various aspects of our growth and impact. We've already heard from several individuals who've been with us for many years, men and women who built the Aga Khan University Hospital and helped make it a leading institution that it is today. We've also heard from some of the beneficiaries of our services, those who can attest that we indeed do amazing things at the Aga Khan University Hospital in Nairobi. 60 years is a long time for sustained leadership. At the hospital in Nairobi, these 60 years have been marked by the development of health professionals and investments in facilities and technology, both of which have transformed the care we provide to our patients from Kenya and the wider region. And our contribution is well recognized. For our patients, the Aga Khan University Hospital is a symbol of compassionate care, as you just heard. For those who work with us over the years, the hospital has been a place where they have built successful careers and made a difference in thousands of lives. And for our partners, it has been an institution that has helped to meet their goals. We are building the knowledge and capability of health professionals. We have provided training for our medical residents, funded fellowships for those seeking subspecialization, and opportunities for all our staff to seek further training, which has all enabled them to deliver more effective treatment and care. We have also provided continuing medical education to medical practitioners from other institutions, not just in Kenya, but across East Africa, as you heard from Sean. So, ladies and gentlemen, we acknowledge that we could not have done all these things without the support of those who believe in us and in our greater cause. I appreciate the support of our donors, many of whom are here today. It is through their support that we have been able to construct new buildings, acquire latest technologies, such as the PET-CT scan that you heard, conduct research in new pharmaceutical drugs that will address diseases afflicting Kenyans, such as cancer. It is not just important to treat cancer, as you heard from Scott, but it is also important that we develop new drugs and new treatments that are specific to the population in Kenya and not based on research done elsewhere. And we are grateful to the government of Kenya for their support of our aspirations over the years. In a similar way, we acknowledge the support of our partners who have found us to be reliable and credible academic medical center that delivers world-class care for our patients. We cannot forget our employees, past and current, who bought into and continue to believe in our vision and work each day to fulfill it. We must also thank our patients who trust us, sometimes at their weakest points in their life, to help restore their health. But we also thank our patients because they teach us much to improve our knowledge and our skills. Ladies and gentlemen, even as we look at the past with immense pride, we must also remember that more is expected of us in the future. Given the rise in non-communicable diseases such as cancer, diabetes, heart disease, and hypertension, we must take a lead role in the search for solutions. We are alive to these expectations, and we are not basking in our past glory. While 60 years, we built a strong foundation on the best equipment and technology, the best staff, the best care for our patients, we believe that the future will be built upon new knowledge, new drugs, new treatments, and new investments in innovative technology and approaches. As the hospital is part of the university, research is the foundation upon which we will continue to pursue excellence and leadership in service delivery and health education. For this reason, we've built our investments in the PET-CT and cyclotron to establish a fully fledged technology, and at the same time, we've established a cancer center that will spearhead research in cancer and become the first base in clinical trials for cancer in East and Central Africa. But this is not the only first that we have in sight. Later this year, we will plan construction of a 100-bed children's specialty hospital on our Nairobi campus that will provide advanced pediatric care. And for those of you who are not familiar what a special children's hospital is, it will provide treatment for children's cancer, children with heart disease that you saw today as an example, and also children with neurological problems. This is not just a normal children's hospital, it will have specialized care, which is much needed in Kenya. We are also working on US accreditation as a stroke, chest pain, and trauma center, the only one of its kind in the region, to add to the accreditation that our hospital has from the Joint Commission, which is the only hospital in Kenya today with this particular accreditation, but we're also going to add the specializations that I mentioned. And we plan to improve our approach to complicated surgeries with the introduction of gamma knife technology, which is a specialized technology that will help our surgeons, skilled surgeons, do even more complicated work, as you've heard. Our upcoming university center opposite the hospital, which are twin towers, about 11 stories high, which will boost our capacity for interdisciplinary research and learning with a long-term view to contribute to providing more solutions to the complex health and social challenges facing the world today. At this point, with all humility, I would like to state something that was in a speech that I made at our convocation last week. And some of you were there, many of you were not. In 2019, the Aga Khan University was found through the Shanghai rankings to be in the top 100 globally in clinical medicine. It was the top university in East Africa in clinical medicine, and it was the only one in Asia, because we have a campus in Asia as well. So this gives you an idea about our aspiration and where we have already reached, and that we want to continue to build on that. But the investments that I just talked about are very few, and the developments that we have planned in the future. Over the next 60 years, over the last 60 years, we've emerged as a leader in East African healthcare. We do not intend to slow down over the next 60 years. Rather, we will leverage new medical technologies and equip our people to ensure that we continue offering the best possible compassionate and high-quality healthcare to Kenyans and East Africa. Once again, I thank each of you for believing in us, for contributing your own special verse in our 60 years narrative that you have heard. You will see the narrative more in the book that I described, the coffee table book. Our story is not yet complete, and I therefore invite you, all of you who are supporters and partners of the Aga Khan University Hospital, to continue flying with us to even greater heights. Thank you. Asanteni sana.